Thank you so much for joining us today. My name is Stuart Tomk. I'm the former brand ambassador and global educator for Nordic Naturals, and now I'm a director with Zinzino. And I'm joined today by Professor Karim Premji from the Institute of Holistic Nutrition. And we're going to discuss why practitioners, why functional medicine doctors and nutritionists need to take a serious look at Zinzino, not just because of the business, but because of the science as well. And what I often say to practitioners down here in the United States, although we're a global company, is that if we could show you how to measurably and quantifiably improve the health of your patients while helping you cover some of, if not all of the overhead of your clinic with little to no stress on yourself as the doctor or as your staff, would you be interested in learning more? Professor Premji, it's such an honor to sit down with you today. Thank you for being here.
Thank you, Stuart. And it's a pleasure being here as well. And yeah, I think this is a really important topic to discuss because there's a lot of people in our field that are working with clients and they want to ensure that they're doing the best possible measures and things that they can do to ensure that they get back into health and well-being. But sometimes they don't have access to the right tools. And a lot of nutritionists out there, especially in Canada, have to rely on working with an intermediary, which might be a client's naturopathic doctor or their medical doctor, to get certain diagnostic blood measures involved. And sometimes, when a client goes to their doctor requesting a test, they come across a lot of obstacles. Sometimes they have to educate their doctor and say, why do you need to do this type of testing? And we find that then clients tend to have this hesitation of getting the results that they might need to get the results for their well-being. And what I loved about Zinzino's concept is this in-home dry blood testing technology that allowed an individual to get tested in the comfort of their home and actually find out what their biomarkers are. And in this case, the blood biomarkers for the omega balance is really critical. We're looking at omega-6 to omega-3 ratios. We're looking at the omega-3 index, along with other factors, which really reveal critical information about inflammation. So as nutritionists in the field that I get to teach, it's one of those tools that are so relevant today that can make such a big difference in their practice in helping identify a root cause problem. And as nutritionists, that's what we love to do, which is go to root cause. We love to dig deep. We do a very, I would say, very sophisticated intake process where we'll sit down with a client, maybe even spend an hour with them going through their history, what they've gone through, what they're dealing with, their sleep, their stress responses, their diet and lifestyle. But we still need to know what's actually happening biochemically in their body. And that's where testing is so critical. Now, as nutritionists, we can't just go out there and order lab work, right? So this is the biggest solution to come in place. Now, there are some other labs that we can do, for example, for gut microbiome testing and other things that are coming into the marketplace. But I can't just go out there and order, say, this omega test or do a vitamin D test. But now that these technologies are available, it makes our practice a lot better.
Well, the place that nutritionists and clinicians and functional medicine doctors start here, at least in the United States, and the team that we're building globally, they're really drawn to the fact that Zinzino's aim is to become the biggest preventive health company in the world. Now, that's what grabbed my heart, right? Let's start with the big why. To measurably move the dial on public health globally by moving from guess-based to test-based nutrition and to ultimately change health as we understand it today. So I'd like to ask you, if you don't mind, if you're willing to tell me, can you just walk us through the process for you as a professor to get comfortable with Zinzino? What did that look like, and what can your colleagues learn from that process?
Absolutely. I think one of the biggest missing gaps in education or knowledge today is the importance of the polyphenol connection that Zinzino brought to the table in awareness. A lot of people don't understand that you do need those polyphenols to ensure that you actually incorporate the omegas into your tissues. So we know that eating seafood, getting adequate fish in the diet is a viable way to increase those omega levels. But then when you look at research and you notice that there's some contradictory studies on fish oil supplementation. So why was that the case? And when we're trying to teach our students, we didn't have an answer.
No, that was one of the paradoxes.
Exactly.
Of the Inuit paradox.
Yes.
And so for anyone that's not quite familiar with what the professor just mentioned, the Inuit diet was the most cardioprotective. Oily fish was the second most cardioprotective, but purified fish oil, minus the drug trials, was the least cardioprotective. And what we've learned, and I'd love your thoughts on this as truly a nutrition professor, when you first learned that the Inuit were eating polyphenols and omega-3s together because they all begin in algae in the food web, and the polyphenols are the chaperones that move the fatty acids through the trophic levels of the fish and ultimately through the gut into the tissue. Can you kind of take us back to your aha moment? I remember mine, but I'd love to hear yours. Like, Zinzino means a small piece with great value. And it's like we missed the boat with omega-3 by focusing exclusively on EPA and DHA. Can you walk us through what was that like when you first learned this?
Yeah, absolutely. Well, I think the biggest aha moment was when I took the test myself, because as a nutritionist, I felt, I was doing the best I could managing my consumption of seed oils and removing the omega-6, but I was taking fish oil supplements to fill in the gap in my diet. And after I got tested, I realized, wait a minute, my omega-3 index isn't in that 8 to 12%.
Even though you were taking it?
Even though I was taking fish oils, I was like, okay, you know what? There's something missing here. So, and then the equation of, well, our balance concept works because of these polyphenols. I was like, oh, okay. So whole food, which is what we try to tell
Right,
to get on. Exactly, which is what works. But we know in today's world, eating fish is always difficult. There's heavy metals, there's plastics, and it's very expensive. So we always tell our clients, oils are always going to be part of a lot of protocols. Clients are coming to you because they're dealing with a health issue. So what are you going to do? You have to give them an orthomolecular dose to deal with a problem, to break a cycle of inflammation. And so we're always just saying, yeah, get the best quality fish oil. And usually those are the professional brands. And there's no question that they're very clean. They have the quantity that's on the label. They adhere to, Friends of the Sea and all of those certifications.
Yeah, but something's missing.
Something's missing. It's not working.
It's not oily fish
exactly
in liquid form.
Exactly.
And so was that an aha moment for you?
That was the aha. So it's like, okay, now we have the solution, which is we found a terrestrial-based polyphenol that we can incorporate into the balance oil. And on its own, olive polyphenols are so
Oh my goodness.
important for your well-being.
Now, I wasn't so familiar with these olive polyphenols, but some of the scientists on our team, some of the doctors have said this, I think you'll appreciate this, that every nutritionist worth their salt, this is a big statement, knows that we need the omega-3s of the Inuit diet and the polyphenols of the Mediterranean diet.
There we go.
So to have this marriage of land and sea together, to know that the extra virgin olive oil high in polyphenols is the uber, the chaperone that helps to create that protective coating around the EPA and DHA so it doesn't oxidize in the body.
Exactly.
And I was guilty. I have to take responsibility for this as the former spokesperson for Nordic Naturals. We argued we have the safest, most effective fish oil on earth because it has the lowest levels of oxidation. That ends up not being the story. We just don't want these oils to oxidize in the body. And it appears as if commercial fish oil may be depleting our body's antioxidants, and in some cases, not all, might be doing more harm than good. Did you have that same experience of, oh my goodness, what have I been doing?
I did, and I think that was the missing gap. So as a teacher in this profession, I'm like, okay, now I get to enhance my lesson plans. I know exactly what to teach.
You got to rewrite it?
I have to rewrite it, but there's a lot that we're learning in omega science, and now that we have these new developments, we've got this groundbreaking study that was just published. We now know that we can be at the cutting edge of, at the end of the day, what are we trying to do? We're trying to help our clients get back into a state of balance. And now that we have the tools from the diagnostic standpoint and the solution, we're not just there to scare people,
right,
that they're out of balance. We want to actually offer a solution. And at Zinzino, we have that, and no one else out there has it. So in my mind, it's one of those professional brands that make total sense to be incorporated into a wellness practitioner's routine, into their client protocols, because it's so foundational. It's one of those foundational things that if you're not getting your essential nutrients, you can't build on top of that. The other protocols, the other modalities won't be as effective. So we want to ensure we get all of the micro and macronutrients handled, and then build on that with the herbs and the homeopathics and the energetics and other things that we feel would assist our clients.
But this needs to be at the top of the list.
This is probably one of the first things you want to do, because inflammation is the root of so many health issues. It's the underlining factor, and it's that piece of the puzzle that we've had issues in addressing, and we're always using certain things that block enzyme pathways, whether it's a medication or an herb.
Or an herb.
But we don't get into balancing the basic building block of the inflammatory pathways, which is having the balance of omega-3 to omega-6 or the arachidonic acid. So when I saw that, I was like, we have a test that you can easily implement. You don't need to go bypass your clinic. You can get it directly into your client's hands.
And it's more predictive than a vein puncture, a wet test.
And a lot of people don't want to do that, right? They would rather just take a little prick, get a test anonymously done in the comfort of their home, but then also have a very affordable solution that will get them back into balance in as little as 120 days.
So let's talk about the business.
Absolutely.
The science is there. The evidence is there. This is the next most important biomarker that you don't know that you should know. But let's talk about integrating it into the clinic, because we have clinicians all over the world now that have been partnering with Zinzino because it's really the democratization of medicine, the democratization of testing. It can be performed in the clinic, but the patient can do it themselves. So when I said this is a way for clinicians to measurably and quantifiably improve the health of their patients while covering some of, if not all of, the overhead of their clinic, now let's talk about the business. How practical do you think this is as a line item in clinics around the world for them to help cover their overhead while moving measurably the health of their patients?
Yeah, that's a great question. What a lot of people don't understand is that as clinicians, when we're working in practice, a lot of the income that we generate comes in consultation fees. And if you have to charge several $100s just to see a client, that's their budget. You know, they want the advice, they want the tool set, but that's the only way a practitioner can survive. To pay for their overhead.
And they spend all their money on the consultation, and now they can't pay for a test and get corrected.
But at the same time, we can't help the masses that we want to help. You know, it's like there's 10 people that need the assistance, but only 1 or 2 will be able to pay the fees in order to see a practitioner, whether it's a naturopath, a nutritionist, a homeopath, because we rely on that to run our operation. Yes, we can align ourselves in our dispensary to have a few products on hand, but usually that's a markup on the product, which means we're not adding value to the actual product.
Correct.
We're just adding a retail profit. So that model, I feel, is not long-term. It doesn't really support the practitioner, and that's why we have so many practitioners that are struggling out there. What I loved about Zinzino's business model is they thought really intuitively of how can we take our marketing dollars and support the practitioner instead of putting it into advertising, instead of giving it to a retail outlet where they're just putting on the shelf and that person walks in and has to choose from an array of products. Why not put that back to the practitioner so that they don't have to charge an exorbitant amount of fees up front, but they can actually help with the commission structure that they put into place to help that practitioner really create a sustainable income.
And create a subscription model. People are going to full script.
Yeah.
It's basically the same thing.
With a difference, because some people that use those services like Full Script, which is great, they give access to clinicians to a whole bunch of different things, but clients are also intelligent. They'll go to Amazon.
And they'll circumnavigate.
They'll circumnavigate afterwards. So, you know, we do know that clients want the best value. They might do that once or twice, but if they're going to be on a supplement for months and years on end, especially with essential nutrients, we want them to get it directly from one source. And what I loved about Zinzino
is it's directly to the patients.
Exactly.
And all the fat that's in the middle that goes to brokers and to free fills and advertising, we cut out all of that so we can bring the highest quality products to the patient. So are your colleagues, I want you to help them see that by getting people on subscription and having all of their patients share it with their friends and family so they can get their products as well, they can build meaningful residual income while measurably moving the dial on public health globally. And that is a different model that nutrition has never seen before.
Exactly. We can still serve many more people and not worry about the finances attached to it. We can do what we were trained to do, which is help people, get them access to the best tools and testing, but then also offer the solutions at a very affordable cost. I would rather my clients pay what they were actually paying for any other professional brand omega, but get the best functioning omega out there and not have to overspend because of the technology involved. And that was brilliant that Zinzino put that
And from a
together.
commercial standpoint, being in retail in the supplement industry my whole life, I look at the balance concept, which is not 10% better, it's 10 times better. And I look at how much the patient gets to pay, gets to pay for it.
Yep.
And I think if this product was on the shelf, it would sell off the shelf at that price. Where many of the direct-to-consumer companies that are out there, especially in sort of this business model, they charge a price that would never fly in the retail world.
Right.
So let's talk about that for a moment. Have you noticed that the Zinzino products are the best quality you've ever seen at the best price for the patient? Isn't that exciting?
That's exceptional because when I look at the price we pay the exact same price as our clients, which is phenomenal, which means that we're not trying to make a markup on the product. It's already designed into the cost system that Zinzino has put into place because their goal isn't a small change in the world. It's a massive impact.
Because how do we duplicate you?
Exactly.
Right? It will be hard to duplicate you and all the other omega-3 experts and nutritionists.
Right.
But this way you can duplicate yourself around the entire world. So some of the income revenue producing activity for the clinic is, and this is brilliant, the clinic can get 100 products on subscription and earn $1,000 a month or more for the clinic. It's just brilliant without having to house the product, because that's what was so 1986, right?
Right.
I can't tell you how many clinics I've been into around the world, and there's like an apothecary inside of an office where most people are doing virtual medicine now, right? Right? We're moving away from analog to digital. And so if AI is going to be driving our decisions, telling us, right, your omega-6/3 level is out of balance, your vitamin D levels is too low, your A1C is too high, this is the future of functional medicine, isn't it?
Absolutely. And what a lot of practitioners forget is when you want to build a global wellness business, if you have a client that may be in India or the Philippines or in the UK, at their local health food store level, they may not carry the same brands.
Right.
So how do you create a protocol that's consistent? And what I liked about Zinzino is we have a consistent test, we have consistent product that ships to over 100 markets globally.
There's a hospital, I won't mention it because they're not on board yet, but it's one of the biggest medical tourist hospitals in the world. And what they liked was all their patients come in from all over the world. They take the test, they get on the oil, they're giving it to them while they're there. But then how do they send them another bottle?
Right.
And how many physicians, because of social media and clinicians, know people who know people in other parts of the world? So in terms of measurably moving the dial on public health globally, I can't think of a better vehicle than this Zinzino subscription model. Can you?
No, I think it works phenomenally well. But I also wanted to add in the point that now a nutritionist can team up with their competitor, another nutritionist that might be in the same space. And instead of competing, they can now work together because through the referral mechanism, that could be part of their business as well. So now there's an incentive to kind of collaborate with your peers or even with your competitors and actually make the impact that we need so desperately.
To make the world a better place.
Exactly.
Professor Karim, it was such an honor to sit down with you.
Thank you.
Thank you so much for being part of our team.
It's been my pleasure, and we're just beginning. So we hope that other practitioners who see this join with us, and we can also help you make a bigger impact in your local communities as well.
Thank you.